Assalamu alaikum. Bismillahirrahmanirrahim. Uh, the topic of today's lecture is Introduction to Research. Now, this topic is basically, you might be aware that it's from our course uh, entitled as the Research Planning and Scientific Writing. In this course, we are going to cover up different topics, including Introduction to Research, Perception of Research, its types, formulating a research problem, then review literature, identifying variables, constructing hypotheses and research design, research type, then sampling design, writing a research proposal, data collection, ethical issues, processing and analysis of the data, statistical analysis using different softwares, presentation or displaying of the data, and thesis dissertation. During this course, we have got about 4 or 5 recommended books, and we will be majorly following the research methodology by Ranjit Kumar for this course's outline. So the first first title is what actually is a research. Research is a way of thinking. Research is either discovery of new facts, enunciation of new principles, or fresh interpretation of the known facts or principles. Until and unless you've got some idea and you just keep it to yourself, it's not a research. You need to enunciate, you need to pronounce the idea in some sort of conference, some workshop, or by sending it to a reputed journal for publication. And then when it is in documented form, when it has been published, then you say that your idea is culminated into a research. At times it can be discovery of absolutely new facts, new things, new principle, new phenomena, or it can be a fresh interpretation. There might be some confusion, some misjudgment, some gap in the knowledge that needs to be covered. So already established facts are there, and you just interpret it. You just go for fresh interpretation of those facts or principle. That is also included under the heading of the research. Suppose like we are in this biomedical engineering, biomedical sciences, a microbiological field, and so you are working in the field of health. You might be a frontline service provider or a supervisor or health administrator, and you might come across with so many different questions. Like these days, and this is one of the most common example these days, the coronavirus is spreading all over the world. It's this pandemic, COVID-19. It is spreading heavily. So if you are a frontline worker, frontline service provider, what kind of questions will come into your mind? These might include, how many patients do I see every day? What are some of the most common conditions that are prevalent among my patients in case of corona or COVID-19, the flu, low-grade fever initially, body pain, these are the symptoms which might be most prevalent. What are the causes of these conditions? What can be? Is this bacterial? Is it viral? Is it some environmental factors that are contributing to it? And why do some people have got a particular conditions whereas others don't have got? Might be because of the immunity, because of the age factor. What are the health needs of the community? What can we do against that kind of that pandemic or that disease? What are the benefits of a program, this program or program to the community? If you initiated some program, some awareness program, what are its benefits? And why do some people use the service while others don't? And what do people think about the service? We have launched a awareness campaign against, let's say, corona on social media, on TV, television networks, or anywhere else. Just you are pasting banners of these, using the mask. You just place them on some streets. There are different measures which can be adopted. And what do people think about that service? How satisfied are the patients with the service? How can the service be improved? So many different questions might come into your mind about these things. So the next one would be definition of the research. Research is a systematic and organized method to finding answers to the question. Research should be systematic, it should be organized. Another definition, it is a systematic investigation into a subject in order to discover new information, a new fact, or reach a new understanding, or to collect information on a subject. Research consists of the prefix as re and search, which means again, to examine. So you are going to examine again something, some phenomena, some fact, some issue, anything, and it is going to be a systematic investigation. Grinnell in 1993, he defined research as a careful, systematic, patient study and investigation in some field of knowledge undertaken to establish facts or principles. That's very comprehensive example. Burns in 1997 defines research as a systematic investigation to find answers to a problem. What is the function? What are the functions of or objectives of a research? You need to understand that the basic function or objective of a research is to answer why and how of a phenomena or an issue. Why is an issue occurring and how is it occurring? And while you are looking answers for this why and how, you might come across you might be looking for answers to what is the phenomena, when has this phenomena started and initiated, how much, what is the amplitude, what is the prevalence, what is the frequency of the phenomena. It's also these you might be coming across so many different questions while finding out the answers for why and how of a phenomena. This is the prime objective of the research. Some other objectives, other prime objectives can include it to discover new facts, to verify or test important existing facts, to analyze an event or process or phenomena, to identify the cause and effect relationship, to develop new scientific tools, concepts, and theories to solve and understand scientific problems. You might be you might be establishing new protocols, standard operating procedures for let's say for identification of microorganisms. That can be a research. And research is also conducted to find out solution to a problem. All these questions have relevance to any discipline, whether you are talking about the social sciences or arts humanities, but medicine seems to have special appetite for such inquiries, the one we listed above, because the thing is, the goal of the medical research is to improve health. And this is not a luxury. This is the thing with the medical sciences. Medical sciences doesn't deal with luxury. Like you want to develop some electronic vehicle, electronic cars. You want to develop some batteries which long laster than 20 years. That can be something of utmost important to humanity, but they are not necessity. Necessity is something which comes across a lot in medical sciences. Like this corona pandemic is affecting throughout the world, and now all the world, WHO is pouring so many fundings throughout the world. Every government is pouring so much funding into the testing of the persons as well as development of the vaccine. So it deals with the human health. So, and the purpose is to learn how systems in the body work, human body work, why we get sick, how to get back to health and stay fit. So this is the purpose of medical sciences. So which is very much in the research process, characteristics and requirements. What are the different characteristics of research? The very first one is research should be controlled. You need to plan your study or research in a way that minimizes the effects of other factors which can affect the relationship. It is difficult to control and minimize the effect of these different factors, or these are called as the confounding factors, are variable, which compete with the exposure of the interest, treatment plan, or anything in expanding the outcome of study. Which these are the factors which actually which can disturb your study. Like you don't want to work in an environment which is not controlled. Like in biomedical sciences, if you're working on some animal mice model, so it is advisable to go to use the mice of the same age, sex, or weight of the mice. It's not advisable that you are going to test a new medicine, new therapeutic some ingredient on an infected mice. And on one hand you have a mice, you have, let's say, 5 mice whose weight is or whose age is about 8 to 10 weeks, and you have got 5 mice who have, or 7 mice which are about 20 weeks old. Their weight might be different, their ages and their sexes should be the same. So it's not advisable to work on a system which is not controlled. So very first, most important thing, especially in biomedical sciences, is to get a controlled environment for the research. Research should be rigorous. It means that the procedure that are being followed to find out the question, the methodology, the protocol uh, that you are working on, that should be relevant, appropriate, and justified. Research should be systematic. The procedure that you have adopted to find answers to certain query, they should follow a certain logical sequence. The different steps cannot be taken in a haphazard way. Like, it's not as advisable you directly go for molecular analysis of something. Let's say you've got some bacteria, so ideally what we do is you just go for gram staining, you look at the colony morphology of the bacteria, then you do some other biochemical characteristic, biochemical identifications, and if you feel, then you go for molecular confirmation. And these are the logical sequences of steps, no? So you need to uh, go with systematic steps. Some other characteristics of the research include: research should be valid and verifiable. So that's very important, that whatever you conclude on the basis of your finding, it should be correct and it can be verified by you and some other. It's not that you are the last one person in the whole world who has done some research, who has done some steps, and they cannot be replicable, they cannot be repeated. Research should be empirical. That's very important. Any conclusion that you write, this is very much specific, they're very much important in biomedical sciences. We will be coming towards that in a few slides later on. So that the conclusions that are being drawn from a research, they should be based on information which is gathered from real life experiences or observations. It's not something, out of this world. You present a phenomena which is absolutely out of this world. You say that, let's say, smoking can cause UTI, urinary tract infections, although we are fully aware that it can lead to lung cancer, and it affects the lungs. So the research should be based on real life events, real life, and the conclusions that are drawn, they should not be contradicting the everyday experiences. Research should be critical. That is the precise interpretation of the finding. The process of investigation must be foolproof and free from any drawbacks. That's very much necessary. The process adopted and procedure used must be able to withstand critical scrutiny. If persons want to scrutinize your study, he should be able to do it because you have used valid procedure, valid protocols for that. Medical research is subjected to empiricism. What is empiricism? Empiricism is a system which is based on observations and experiences. And these observations, real life observations and experiences, real life experiences, they together form the evidence, body of the evidence in medical research. Medical sciences, they have got no lemmas or no theorems. It must not depend on evidence, it must depend on evidence provided by the observation experiences. Like in contrast, mathematics and some other physical sciences, they are based on theories and theorems. They are deductive and they are not empirical. Like in biomedical sciences, you cannot say that 2 plus 2 is always 4. No two live human entities might, they might behave the same way. It might be, a person, when he is exposed to smoke or dust, he is well, he's absolutely fine, he's okay. Whereas another person, when he is exposed to the same surge, same dust or smoke, he will started coughing, he might start wheezing, he might start sneezing. So no two human system, they are not absolutely together. So it's really based on, this empiricism is based on induction from sensual hearing, sensual learning. Research is systematic. I already talked about it, that there is a definite set of procedure. The protocols are steps that you will be following in order to get the most accurate results. Research is organized, whereas there is a structure of research. A researcher should be patient. Your study might take time. The experiments, you might need to repeat it, especially in biomedical sciences. You never know what the results can be. 2 plus 2 is not necessarily 4. So you should be ambitious. That's very important. A researcher should be ambitious. He should be curious about some phenomena. Only then he is going to look out for some answers for that very problem. And remember, it's a research. It's not something which is totally, you are going to re-examine most of the time, re-examining the things. You are going to examining the things with a different perspective. That's the research. Now, the challenges of medical research. Let me just grab this screen away so that we could start it. What are the challenges of medical research? All scientific results, they are susceptible to error, but uncertainty is something which is a very much integral part of the medical framework. I talked earlier about this. Any research on diagnostics, prophylactic, and therapeutic modalities or on risk assessment is empirical, especially in biomedical sciences. It should be based on the real life observations and experiences. No two biological entities have ever been exactly alike. That's the problem with biomedical sciences. That's the problem. That the challenge of that is one of the prime challenge of the medical research, because you might be experimenting on two biological entities and they might be behaving totally differently against a phenomenon. Our knowledge about the biological process still is extremely limited. There are two aspects: first, variation, and second, limitation of knowledge. We throw an apparently tough challenge, because biological system, it show variations, it show mutations, it show differentiations, and then we have got this limit. I mean, we never know. One day you might be uh, coming across, you might be living in an era of or epidemic of cholera or tuberculosis, and then you come across with flu, then you come across with nowadays like coronavirus or this COVID-19. So every time you get some knowledge about some issue or in the biomedical sciences, in the medical research, then you come across with another issue. Still, medical sciences has not only survived but is sticking with full vigor. Death rates have declined in the past 50 years, and expectancy is showing a relentless rise in almost all nations throughout the world. Burden of disease is steadily but surely declining in most countries. So these are few of the things which I wanted to discuss in this presentation. Um, we will be getting the new topics soon. Take care.